The placebo effect has been one of the most fascinating and debated topics in medicine. This effect refers to a patient's actual improvement in health after taking a treatment or medication with no therapeutic properties, simply because they believe it to be an effective treatment. The placebo effect shows how a person's belief in a treatment can directly impact their mental and physical well-being. This phenomenon, which has been studied for many years in the medical field, still remains not fully understood today. However, the power of the placebo effect has been observed many times in scientific experiments and clinical trials. Before diving into the scientific foundations of the placebo effect, let's briefly look at its history. The term placebo comes from the Latin word meaning "I shall please" and was first introduced into medical literature in the 18th century. At that time, doctors would give their patients inert substances or fake treatments, believing that these treatments would please and psychologically comfort the patients. Over time, however, research has shown that the placebo effect goes beyond mere psychological comfort and can lead to actual biological changes. One of the most well-known experiments on the placebo effect was conducted in 1955 by Henry Beecher. During the war, Beecher used placebo injections to relieve soldiers' pain when morphine was not available. The soldiers, believing that these fake medications were relieving their pain, actually experienced a reduction in their pain. This event revealed just how powerful the placebo effect can be in pain management. So, what is the mechanism behind the placebo effect? How can we explain the strong connection between the brain and the body? The brain is considered the command center of the body and is responsible for many biological processes. If a person believes that a treatment will heal them, the brain can respond with various biochemical reactions to match this belief. For example, if a person believes their pain will decrease, the brain may increase the release of natural painkillers like endorphins, leading to a reduction in the perception of pain. Another important mechanism in explaining this phenomenon is the expectancy theory. When people expect a specific outcome from a treatment, this expectation can lead to biological changes in the body. For example, if a person believes that a pill will reduce their pain, this expectation can cause increased activity in the brain regions that regulate pain perception. Neurological research has shown that during the placebo effect, certain areas of the brain show increased activity, similar to the effects produced by real medications. To understand the power of the placebo effect, it's important to note its significant role not only in pain management, but also in the treatment of depression. A 2002 meta-analysis found that many medications used for depression provided only limited benefits compared to placebo drugs. This highlights how important a patient's belief in a treatment can be for the treatment of psychological disorders. Many patients who took placebo drugs experienced significant reductions in depression symptoms, proving that the placebo effect has deep impacts not only on physical ailments, but also on mental health. The placebo effect is not limited to medications. It can also be observed in surgical interventions. In a 2014 study, placebo surgeries were performed on patients undergoing knee surgery. When comparing patients who received real surgery with those who underwent placebo surgery, both groups showed similar levels of improvement. This finding suggests that even in surgical procedures, the placebo effect plays a strong role, further highlighting the complex interaction between the brain and the body. However, there is also a downside to the placebo effect, the nocebo effect. The nocebo effect occurs when a patient believes they will experience side effects from a treatment and then actually experiences those side effects. For example, if a patient believes a medication will cause nausea, they may experience nausea even if the substance contains no active ingredient. The nocebo effect is considered the opposite of the placebo effect, demonstrating that people's expectations can have both positive and negative effects on the body. The placebo effect plays a crucial role in clinical research. In studies testing the efficacy of new medications, the placebo group is compared with the group receiving the actual drug. If the drug provides greater improvement than the placebo group, it can be concluded that the drug is effective. However, sometimes the placebo group also shows significant improvements, once again demonstrating the power of the placebo effect. For this reason, considering and accurately measuring the placebo effect is critical in understanding the true efficacy of drugs in clinical research. The placebo effect is commonly used in modern medicine and alternative medicine alike. Many alternative treatments, such as acupuncture, homeopathy, and herbal remedies, may rely heavily on the placebo effect. For example, some patients undergoing acupuncture treatments believe the therapy helps them feel better. However, research has shown that the efficacy of these treatments often largely depends on the placebo effect. In other words, the patient's belief in the treatment can make it effective. Looking back in history, we can see that the placebo effect dates back to ancient times. In ancient Egypt, Greece, and the Roman Empire, healers gave patients inert substances to try and cure them. At that time, patients' belief in the treatment contributed to the healing of many illnesses. Similarly, during the Middle Ages, many herbal mixtures were used despite lacking a scientific basis. Yet patients' belief in these remedies led to their recovery. This shows that the placebo effect has played an important role, even in the depths of history. Modern medical research into the placebo effect has helped us better understand the strong connection between the mind and body. Studies in neuroscience, psychology, and pharmacology are all working to unravel the complexity of the placebo effect. For example, a 2015 study revealed that the effectiveness of placebo drugs may be related to genetic factors. This study found that certain genes make individuals more susceptible to the placebo effect, and this genetic predisposition can increase the strength of the effect. This finding demonstrates that the placebo effect is not only mental, but also has a biological basis. In conclusion, the placebo effect is one of the most fascinating phenomena in medicine and science. Helping us better understand the brain's control over the body, this effect could contribute to the development of new treatment methods in medicine. The placebo effect shows that even healing with a sugar pill is possible, highlighting once again the incredible power of the human mind.